Welcome to the second day of PMAC 2026. I have to say this is a familiar topic to all of us. We are facing rising challenges of population dynamics and health system transformations. This is topic not concerning me or the panel, it's all of us. So to get your view and get a pulse of the audience, we'll start from a Menti exercise. We'll start a Menti exercise, and I introduce my colleague, Saldimini, who had been working with me for a while on this session. He's my co-organizer, Saldimini.
Thank you so much, Fang. What a great start to Friday, and it's only going to get better with our exciting panel that's going to be up in a moment. But before that, we'd like to hear from you. This plenary will frame the next 2.5 to 3 hours of this morning. So please scan the QR code and please join us on Menti for a few minutes and share your thoughts. All right, we have about 40 people. So Angela and Manit, okay to continue? Great. So let's go to the first question of this morning. You will have seen that the parallel sessions reflect the different aspects of the health system. Which one do you think is the one that needs the most radical change right now? What does it look like to you, Fang, from that side of the room? Financing, so great. We do have a few funders here, so it's a good sign. So financing followed by long-term care. So the session that will look at these topics, please do make a note to see which one is going to really pique participants' interest. Great. Shall we move to the next one? These systems don't operate in vacuums. So what we want to hear from you is which values would you think you will fight for to shape these systems as we go forward? Equity, okay, very much central to the theme of PMAC 2026. Empathy, people-centered care. Discipline, that's an interesting one. Love, we heard a bit about that yesterday evening for intergenerational, intergenerational harmony. So it's a good one. Access, community, decolonization, indeed. Also very much linked to a previous PMAC topic as well. Social norms, governance, a lot to unpack here. So hopefully the speakers and the moderator are taking note of all your ideas. Great. Shall we go to the next one? Because all of these are great, but what will happen if we don't take action now? What do you think is going to be the consequence of inaction today? The SDGs are now only 4 years away. Economic loss, as the video showed us yesterday, is that all? Inequity, availability, early death, financial crises, and further fragmentation. But inequity really will be the biggest cost, and that's something, as you have all shared, is probably most dear to all of you and all of us here at PMAC 2026. So with that, Fang, we'll hand it back to you to take it ahead.
Great, thank you, Sada. First, I want you to really take a mental image, a mental photo of the 3 Menti questions, because I will ask the same question to our panelists. My name is Feng Zhao. I'm with the World Bank and also a member of PMAC IOC. I'm very pleased to facilitate today's plenary session on demographic shifts and health system transformation. You know, the interaction between population dynamic and health system is not new. The first global population conference took place in Geneva in 1927, almost 100 years ago. The first global health system conference, the landmark International Conference on Primary Health Care, occurred in Alma-Ata in 1978, nearly 50 years ago. The first integrated Population Dynamic and Health System Conference was held in Cairo in 1994, nearly more than 30 years ago. So I stand to be corrected on the exact dates and events, but the messages remain the same. Global debates on population dynamic and changes and health system transformation date back over a century. So, what is new this time around? Let me share my perspectives. First, what is new is the context in which demographic change is unfolding today. The pace of change is faster, and the patterns are much more uneven. Demographic transition is no longer synchronized across countries. Several countries are aging before they become wealthy, which leave little physical space to expand health and social care. Chris Murray highlighted many of those dramatic shifts in his keynote yesterday. Second, the implications for health system are much more complex than before. As population age, health needs shift towards non-communicable diseases and mental health conditions. This requires prevention, behavior change, as well as continuous, coordinated, and people-centered care. Yet many health systems are designed for acute episodic care and struggling to adapt. Inaction at this juncture will be very, very costly. Numerous publications, including my own work on reimagining primary health care and the three-layer framework for investing in health system resilience, has called for fundamental paradigm shifts in how health systems are designed and financed. Third, demographic transition creates direct physical stress. Aging population increase health spending, while shrinking working age population narrow the tax base. In low and middle income countries, declining development assistance and geopolitical tensions compound those pressures. Policymakers face increasingly difficult trade-off between coverage, quality, and financial protection. As Professor Takimi rightly pointed out, the golden age of global health is behind us. We're now facing a new set of health financing challenges, and that require innovative approaches. Fourth, digital technology offers major opportunities. Telemedicine, data analytics, and AI can improve access, efficiency, and quality. At the same time, unequal access and weak governance risk widening disparities. The challenge is to harness digital transformation in ways that strengthen health systems rather than fragment them. For today's panel discussion, we will focus on several simple yet fundamental questions. What are the pressing issues confronting health systems in responding to the shifting needs? And how should health systems respond? Which area require the most radical transformation? Now, we have a distinguished panel to help us to explore those questions. Following this plenary, we have 5 parallel sessions to dive deeper into the key dimensions of health systems, including human resource for health, financing, service delivery, people-centered long-term care, and the value and ethics in population policy. Please join those parallel sessions after this plenary. So without further ado, it is my pleasure to invite our panelists to the stage. First, Dashiell Dichin Wamo, head of PMAC Secretariat, Bhutan's National Agency for Mental Health and Child Protection, and the former Minister of Health of Bhutan. Dr. Jamie Waming, Executive Director of Equity Wellcome, where he champions transformative research, leadership, and innovations for health equity. Dr. Alan Lee, WHO representative to Thailand and former Assistant Director General at WHO headquarters. Last but not least, Professor Ntobeko Ntusi, President and CEO of South African Medical Research Council. Welcome. And this is a time to revisit your mental photos you have printed in your brain of the Menti question, because I will ask the panel the same question and see how consistent we are. So as I said, we have a simple question, but it's not an easy one. As our health system ready for shifting demographic needs, and what's happened if we fail to act now? Dashiell, I want to start with you. You've been to the Minister of Health. You chaired the World Health Assembly. I think it's not difficult to reach consensus now, but we say the devil is in the details. What do you say how system need to move? What the most difficult areas facing us?
Thank you, Fang. Good morning, everyone, and Kuzuzongpola to everyone. It's wonderful to be here on this platform. For me personally, I think this is a story of a very small country, wedged between the two giants, with a population of 1.4 billion in the north and 1.4 billion in the south. So whatever I suggest or discuss may not be relevant for many who are here. But then, as you rightly pointed out, I think we really have to look at our health system. For Bhutan, health financing as the morning mentee is a huge pressing concern. The second one is service delivery. Then the third one is, of course, health workforce. Bhutan, for many who don't know Bhutan, is a very small country known for its happiness index. And people assume that we are a happy country, so we don't have problems. We do. I think our health system at the moment is at a very fragile state. And I use the word fragile state because our denominator is very small. We are talking about 0.79 million. So that's less than 1 million. That's a little more than 500,000. And then when we look at our health system and when we look at health financing is publicly funded. So Bhutan truly has access to universal health coverage to the extent that if a patient cannot be treated in Bhutan, patient is referred on the expense of the government to abroad to get treatment. And for a small country, middle high income country, to do that is incredible. But is it sustainable is the question. And today, how do we sustain that in the current economic landscape, where donors are pulling out, where available resources are becoming little? So for us, for a small nation, and I'm sure when I say this, I probably am echoing many small nations that are going through similar transitions and similar thinking, is what do we do? For Bhutan, the challenge is of course, how do we sustain the free healthcare? Bhutan is a country which always believed in access to health as a basic human right. That everybody, regardless of who you are, must have access to free healthcare. You know, somebody who cannot afford to pay should not be denied health services. And when I say health services for free, we are talking about from primary to tertiary level care is free, including, by the way, dental. So then the question at the moment as a policymaker is how do you sustain a model like this? Because our tax base for revenue generation is also very small because of our denominator. And now with the shift in in fertility and the population growth. Just in my lifetime, in the 1980s, where the fertility rate was 6, to today we are hovering around 1.7. And that really depends on which data you look at it. Some say it's 1.4, some says it's 1.7, but it's definitely below replacement. So we don't have the economic base. And if you look at the demographic pyramid, the shift, the transformation that is happening to the demographic pyramid is radical. And I want to use the word radical because it's so visible for Bhutan. And not just today, not just tomorrow, it's happening as we speak. Just in my lifetime, things have gone from, a population growth of, I think, 3.5 to today, less than 1%. Just in my lifetime. So it's happening at a pace that we can't even imagine. And aging is becoming visible. And then we look at our health system and we look at service delivery, right? So our health system is designed for delivering primary healthcare system. And suddenly, because of this epidemiological shift that is happening from infectious disease to more communicable diseases, health system is not equipped to deal with it. And again, this is not just Bhutan's problem. This is a problem of many smaller countries who have smaller economies, smaller population, who are facing this issue at the moment. And then we talk about human resource, health human resource. And I was so happy to see that on the earlier mentee as well. It's a huge concern for a small nation like ours. Just to give you an example, in 2023 alone, 12,000 Bhutanese have left the country to go to Australia, for example, for better opportunities. And we can't say, please don't go, right? But then that's, for many who are coming from bigger country, 12,000 may not be anything, right? If you're from India, if you're from China, 12,000 is nothing. But for us, that accounts for 1.5% of our population. And it has a huge impact because these people who are leaving, Fang, you know very well, these are people who are skilled, educated. The nation has invested in them through free healthcare and free education. And now what we are experiencing in Bhutan is a drain in a health workforce. So you will see tomorrow, if you Google up and you will see what is the pressing issue in the health sector, you will see attrition as one of the pressing issues. Because in Bhutan, when we're talking about tertiary level care, which now, because of the epidemiological shift that is needed, we see that we just don't have the health resources to provide those services. So we'll end up spending at least 1/3 of our annual health budget on referral outside. And that's a drain to our economy. That's a huge amount of money we are talking about. That could go to enhancing education, improving road infrastructure, public infrastructure. But that money has to be spent on referral outside the country. And it's a significant amount of money.
Indeed, indeed. So Bhutan facing multitude of challenges, right? You mentioned house financing and service delivery and also human resource for health, which sort of consistent with what in people's mind. But yet Bhutan have achieved a lot given all those difficulties. I remember I visited Bhutan, your COVID program. The vaccine coverage is really off the top, including third dose over 90%. I have not seen that anywhere in the world. So later on in the second round, I'll ask you, despite all those challenges, how Bhutan move forward with this health system transformation agenda and achieve what you have, really remarkably progressed. Let's move to Jamie. Jamie, you're well positioned to address the equity issue, right? So I'll like to have your view on how we ready for the shift, particularly taking into equity into account.
Thank you very much, and good morning, everyone. Thank you for being here. It's a great privilege to be part of this important conversation. So demographic transitions or shifts are currently a huge stress test for health systems everywhere. And I think the changes, whether you're talking about aging, whether you're talking about youth bulges or migration, are really interacting with existing inequities. And how we respond now, I think, will determine whether those gaps widen or whether we actually create opportunities for more resilient and fairer health systems. So our challenge really is, how do we get to a situation where we can together build sustainable, better coordinated, evidence-driven and equity-centered health systems support across the life course. And I think I would say that the first thing that we need to do is really to change the way we think about health systems. We often think about health systems as simply a reactive service provision, and that's it. And I think it's more about shifting our thinking from that sort of narrow focus to something broader, something more ambitious, thinking about health systems as a social institution that underpins well-being, human dignity, human development, economic growth, and so forth. So I think that's the first move that we need to make. And I don't think our health systems are quite ready for that challenge yet. And I think in part that's due to the fact that our health systems are so linked to the global health architecture. And the global health architecture at the moment is really not fit for purpose. It was built for a different era, an era in which the focus was really more on infectious disease control, relatively predictable change, and supporting donor-driven priorities. And those assumptions shape how money flows, the kinds of services that are provided, and the accountability structures that we have at country level. And today's realities, whether you're talking about demographic shifts, climate change, whatever it is, I think have exposed the fundamental structural inadequacies of the global health infrastructure. And just to mention a few of those, fragmentation is a huge problem. The fact that you have so many actors ranging from multilateral organizations to global health initiatives, to philanthropies, to national governments, to civil society, all engaged in trying to improve health systems and really working in parallel and not in a joined up way. Malawi, for example, just as an example, until fairly recently had 50 different health plans. And each of those health plans was driven by some international actor. It's impossible to deal with that as a minister of health of a country trying to improve health. So it's fragmentation. I think the other one is dependency. There's too much dependency on a few powerful donors. I think that we've seen when priorities shift or the funding is cut down, there are huge disruptions to health services and to the research ecosystems. There's issues of governance where priorities are set in boardrooms in the global north, which is sometimes out of touch with the realities on the ground. And then there is within country, I think, just underinvestment in health systems, platforms, as well as underinvestment in improving the social determinants of health. And so I think all of those are issues that we have to tackle. If we don't act now, we will have sicker people, we will have weaker economies, and we will have increasingly dysfunctional health systems. And I think just lastly to say that I think what we need to realize is that the cost of inaction will far outweigh the cost of building equitable, evidence-driven systems now.
Thank you so much, Jamie. Your points remind me what we discussed quite a bit during the special session on the governance structure of global health and also on the financing part. Thank you for your insights. Helen, WHO has done a lot of work in health systems, right? And also dive deeper into different dimensions of health systems. We're facing multitude of challenges, like Dashio Dichin one more has said. What's your take? How should we addressing those challenges?
So thank you very much, Fen. Let me start with Sawadika, because you put my name under Thailand. I'm very proud to be Thailand, to serve as WHO representative. So Sawadi Bime, which means Happy New Year to everyone. So to respond to your question, I hope I can answer yes, but our reality is absolutely no. We are not ready for your question, but also we are not ready for the future. I believe that there's no single country in the world is fully equipped to respond such change, as you mentioned that, because we are living in a very fundamentally different and complex world. Why we are responding immediately issues so many challenges today when we wake up. But there are emerging issues are coming, and we are not be ahead of curve to respond to that. So that's my conclusion, but I would like to remind that I do not know what I do not know. So my conclusion might be not totally accurate, but at least from my Excellency, former Health Minister Bhutan, so happy to listen to you, and you conclude for a small country like Bhutan is not ready. So, as many of us mentioned, our current health care system have not been designed to cope with this newly emerging issue. Therefore, transformation is really the must. So the question here is, what happens if we fail to act now? So basically, my conclusion here is the consequence of cost of inaction is huge. So Jamie mentioned about sick people. I also agree with you. I put my thinking, we will see the sick population, we will see more crises, we will live in an ailed world. So in conclusion, I think we may see the premature deaths will be increased, quality of life will not be possible, and health expenditure will be increasing, and out-of-pocket payment even will be rising. We already have 2.1 billion people who are facing financial hardship based on World Bank WHO estimation. I would imagine it will be increasing if we don't take action now. And the poverty reduction, like Thailand, many countries has significant progress on poverty reduction. It may be reversed. Of course, we talk about economic growth might be slow down. So I think this is not hypothetical. If we don't take any action now, doing business as usual to live with the old healthcare system that's not designed for the future, I think it will happen. So my fear is the more crises and the disasters. But my conclusion here is very positive. It's preventable. If we take action, it's preventable. Thank you.
Thank you. Thank you so much, Ellen. One thing I want to mention, if you haven't read the UHC Global Monitoring Report, please take time to read it. It really highlights the challenges and progress we are facing and we have made. Good. Professor, you are uniquely positioned from the research point of view. What's your take on this question?
Thank you very much, Frank. It really is an absolute delight to contribute in the midst of this highly esteemed panel. The consequences of inaction are too dire to consider. At best, we risk maintaining the status quo, but at worst, we have many risks, which include ever-widening health disparities, reducing equity, and reducing global solidarity, as well as worsening global burden of disease, and all of these occurring in the context of the planetary crisis, the greater fragmentation of health systems that my colleagues have spoken about, increasing economic vulnerabilities, and of course, the demographic shifts that we have heard about in the last day, including the fact that at the end of this century, 40% of the world's population will reside in Africa. We will see rising global life expectancy, but at the same time, significant reductions in fertility rates, all of which have got enormous implications for health. So with this background, I think that there are many fundamentals that are worth considering. And all of these are important, from financing to digital health to health system strengthening. But I wish to just focus a little bit on the centrality of having sound human resources for health. These are, in my view, critically important because many health systems are today characterized by severe staff shortages, issues of migration, as you've heard from Deshan, burnout among staff, high rates of turnover, worsening demand, as well as increased patient needs. In many contexts, still challenges with optimal training, as well as challenges with technology integration. And ultimately, if we do not have sound plans for how we provide human resources for our health systems, this has a huge knock-on effect and implications for equity world over. Thank you.
Great, thank you so much, very insightful. Now you heard of the panelists and their view on the challenges. We do face a multitude of challenges. Now, the second round question, maybe we need your concrete, short, succinct answer is how we respond, given all this challenge we're facing. How we respond without leaving equity behind. Let's use the same order. Dashiell, please.
Thank you. I'm looking for solutions. I think I just want to echo what Jimmy just said. Really re-look and rethink at the global health architecture. Because I think when we are talking about a national health system, it's part of a larger, bigger architecture that's part and parcel of what we are trying to achieve. I would agree that there are some consensus in what we want to do, but there is no action. And I think it's time now we support that consensus with action and resources. So consensus alone, the aspirational statement alone, I think does not translate to the current crisis that we are having. So I think it's important to not only have consensus in drafting an aspirational statement, but have consensus and support in implementing and translating that aspirational vision into reality. And that's what I would like to say. Thank you.
Thank you. Thank you so much. Jamie, your take.
Yeah, so I think that critical to moving forward would be that we need to work together to design health systems across the health life course, which is anchored in primary health care. I think that is an essential, and I think we've known this for a long time. I think those systems must also deeply embed learning and research, because without that, systems are not able to adapt and respond. I think, as mentioned, equity must be front and center in what we do, both in terms of healthcare delivery, but also the research and the evidence that supports that. Because I think that makes health systems relevant, resilient, and responsive. And then I think, to agree with my colleagues here, what we need is long-term investment. I don't think we can really move, and I think the Menti meter that we had kind of emphasized that as well, how important financial investment is. Short-term projects are fine. I think they have their place, but they certainly don't take us forward in terms of better plannings and sustainability. And so really we need to ask ourselves, what is it that we want to achieve in the health system over the next 20 to 30 years? Let's have a long-term view. Let's not just fix the problem over the next few years and leave it at that. Let's go beyond thinking of health as a cost and think of it as a strategic investment, something which builds social cohesion, as we've heard, economic development and human development. And then I want to challenge individual countries as well. I mean, I do think that, if we're going to change, I talked about a few funders calling all the shots. And I do think if you want to really change that we need more skin in the game from individual countries, really investing seriously in domestic financing of health. Now, I know that there are many challenges in that regard, and I recognize that, particularly for the low-resourced environments. And so that's where I think partnerships are so essential. And I think partnerships would start with, let's say, regional partnerships. Regional partnerships could be very helpful for pooling resources, for coordinating responses, and for shared learning. And then lastly, I think global partnerships will still remain important, but not the kind that we have now, the kind that is donor-led, donor-driven. We need global partnerships that respect local and regional priorities, that amplify local voices, that build ecosystems within countries, and that encourage South-to-South collaboration. And if I may just take 1 minute to say that at Wellcome Trust, we have really been trying to, embark on a journey to embed equity in everything we do. And that includes the way we engage internationally. We have shifted in terms of our thinking about funding models. We have, partnerships with governments, with foundations in various countries, where the decision-making and the governance is shifted over to the regions, to the countries. We have deltas in Africa, working with Science for Africa Foundation. We have the India Alliance, working with the Indian government. And of course, we've just launched CDream right here in Bangkok, which is co-funded, co-designed with our regional partners and regionally governed. And then the other, just to conclude, is because of the geopolitical upheaval and the intensity of the discussions now on what is the way forward, we have also convened regional dialogues to bring people together from governments to civil society so that we can listen, learn, and support and find a way forward together.
Thank you. Thank you so much. Really, we welcome Trust's move recently to really help move this agenda forward. Alan, your take.
Thank you very much. I think, Feng, you mentioned in your opening remark, health system transformation is not new totally. But I think different countries have been going through different stages, and there are a lot of incremental improvement, if I may say. But for me, I think we need to have a radical and a strategical shift from the traditional healthcare system that focus on ill people towards a broader ecosystem for co-creating health. So a little bit long, but that's my dream, because we know that health is not totally created in the clinic, hospital, but created at home and the school, and we all know that community. So that's my take. I think the largest health gain today actually come from prevention, health promotion, and also upstream determinant. I don't know how much time I have, but I really think that in terms of priority is investment in more prevention, promotion, upstream intervention, and also we need a fit for the future workforce. And maybe allow me very briefly mention about 3 concrete examples as part of solution. The first about health tax. We know that NCD risk factor, right? We do not need to repeat. But if we can raise health tax, and this really good for public health and also for the generated revenue. I do not need to go further. WHO does advocate for this 3 by 35 initiative. Second concrete example is country example, Thailand. And I'm still learning, but Thailand has excellent foundation to moving towards even more people-centered prevention, primary healthcare, focused healthcare system. Maybe no time, but I want to mention one healthcare worker story that I talk, because workforce is important. When I talk to a hospital director, I asking them, what's the challenge are you facing? The one hospital director. So many NCDs is coming. And what is your solution? Expand hospital bed. I want to have a new building. After 3 years, I talked to the same hospital director, and we have a hospital bed cannot cope. And another inspiring story in the Switzerland, when I talked to the doctor, okay, you have one young teenager came here who broken their leg, injury. Then this doctor fixed, of course, injury and asking why that happened. I drank yesterday. Why you drank? Oh no, I rode bicycle and I falling down. And why? I drank. And why? I hate school. And why? After asking all things, you can find the parents just newly divorced. So it's a family. So you can see these people fix the broken. Okay, you come back to me in 1 week. And this doctor was able to understand why this happened to this teenager and was able to help him to refer to the school services and other social services. At the end, the beautiful story here is this boy quit up drinking, smoking, and went back to school. Of course, they cannot change their parents' situation. So thank you very much. So this is the role of healthcare workers. Both are, one is worried in taking that approach, and another feel very proud to be part of a healthcare system to help people.
Thank you, Alan, for sharing those insightful stories. Professor, your take. Then I really want to open it up because I assume everybody has a say on this topic. Please go ahead.
Thanks, Feng. So in my last response, I zoned in on the importance of human resources for health. And I wish to just focus on what I see to be the critical role that health professionals will need to play in a health system of the future, considering the rapidly changing health landscape and the demographic transitions we've been speaking about. So firstly, I think that health professionals will be called upon to be providers of high quality, patient-centered care. And what this means is that they will need to provide safe, effective, and compassionate care, to be experts in multimorbidity management, and ultimately stewards of shared decision-making together with their patients and patients' families. The second important role, in my view, is that in an era of declining resources, health professionals will need to be stewards of health systems, dealing with the rising costs, constrained budgets, ensuring that there is greater system efficiency. Thirdly, health professionals of the future will need to be agents of innovation and digital transformation. They need to be au fait with technologies, use of AI and digital health, as well as dealing with ever-increasing data points in the management of their patients. They will also need to be producers of knowledge and translators of new knowledge, and be able to rapidly assimilate evolving evidence, to generate new knowledge themselves through their own research, have the ability to critically appraise literature, and importantly, to translate knowledge into practice. And then finally, I think it will become imperative that healthcare workers of the future are advocates for greater equity and population health, and to do this by addressing the social and structural determinants of health through greater inclusive policies, but also advocating for universal health coverage of the populations in which they work.
Thank you. Thank you so much. Thank you for all the insight. Now I want to invite our colleagues on the floor to come for your questions. Please line up on the microphone. While you line up, I want to invite Sauda come back for our last mentee question, which is a forward-looking question. Possibly add some positive spin in those in this conversation. Please, Sauda. Okay, so you can see the dynamic on the screen while we're taking questions. I have Kate and Dennis, and then the lady behind. Yeah.
Good morning. I'm Dr. Kate Telenko from Corvus Health. It's a social enterprise with the mission of giving all people access to health workers. And so happy that several of the speakers mentioned AI, because I think it's an incredible potential tool for health workers, and many low-income countries will be able to leapfrog to AI in the way they've leapfrogged a whole bunch of other health systems elements. So my question for you is, has your country started to develop a legal and regulatory framework for AI? Because health workers won't feel comfortable using it until that's in place. Thank you.
Thank you. Thank you, Kate. Dennis?
Great, thank you. And terrific discussion so far. As we talk about preparing for the future and the next generation of health workers, question I have is, we look at the shifting epidemiology, the new challenges they're going to have, the institutions that train them, prepare them to be professionals and provide in-service training along the way, are they themselves aligning their training capabilities with these new challenges? And I'm particularly thinking about, are professionals being adequately prepared to deal with geriatric care as we move forward, or in the case of Africa, the widespread elevation of non-communicable diseases? So thank you. It goes back to medical schools, nursing schools, et cetera.
Thank you. Thank you, Dennis. Can you introduce yourself and then
Yes.
the gentleman behind?
Yeah.
No,
Thank
you'll
you.
go first then. Yeah.
Thank you. And it's really wonderful panel. I'm Jamila Rabi, WR Iraq. You know, we understand that there are a lot of needs, and we know the gaps, challenges, and we know the solutions. But still, we are not really have changing the mindset to focus on the quick wins. So from the panel, what are the quick wins to take now to make the transformation of health system? Thank you.
Thank you. We'll take one more, and we'll come back to the panel. Please introduce yourself.
Ben Johnson, I'm Chief Editor of Nature Health. It's a new academic journal from Nature and the Nature portfolio we launched 2 weeks ago. As a journal editor, I've seen that there's incredible innovation happening in low and middle income countries that the whole world can learn from. And I just wonder, I myself am thinking, how can we make sure that we're publishing and sharing these innovations? But I wonder what else we can do as a community to make sure that knowledge is flowing in all directions, not just from the global north down to the global south. And two things that I'm thinking of. One is the role of community health workers, where there's been huge innovation in places like Brazil and India, and also digital technologies, where I see huge innovation in places like Rwanda, Kenya, India. Thank you.
Thank you so much. Wonderful set of questions. Let's come back to the panel. First, on AI and human resource for health. Who want to take this one?
Thank you, Kate, for that question. I think technology has a huge potential, especially for countries that lack human resources. For Bhutan specifically, Bhutan came up with a legislation on digital health and really looking at digital, national digital ID system. And this is the only system where it is backed by a legislation. So we are definitely looking at having proper frameworks in place to roll out the digital transformation. We see that as an asset to compensate for what we lack at the moment, which is health human resource, saying how can we build a robust digital backbone so that it will support the health system in service delivery, in governance, in research, and in getting policy direction. So this is an evolving discussion that we are having at all level of the government. I'm not aware that in most of our regions, I think the legislation and the policy around AIs are in the process of being drafted, and there's a lot of discussions that are happening in that area, at least in our part of the world. Thank you. Back to you, Fang.
Good. I really like Dennis's question. Also concerning Africa, maybe Professor Ntobeko, you can take on this one.
I think the situation at Dennis is quite variable. But certainly, having been involved as an examiner for many colleges around sub-Saharan Africa, there is increasing recognition of the changing demography and the way in which healthcare workers are being trained does take those changes into account. And so there is a greater focus on NCDs, on meeting the needs of an aging population, a focus on health systems strengthening, but also increase exposure to digital applications and the role of innovation in health. And I see this not only at my own medical school, but in many medical schools and training colleges in the region.
Yeah, great, thank you. I'm really glad colleagues from Nature is here. The knowledge agenda is huge. So maybe Jamie, Wellcome Trust, you have done the program you mentioned, also touch on knowledge and cross-learning. Maybe you can take on this one.
Yeah, I think the first thing to say is that I agree that there is deep knowledge in communities, in societies. I think very often, people come into these environments and I think that the knowledge flow needs to come from the global north only to the global south. I think it's one of the important things is really to tap the local wisdom, the expertise of people who work there, people who understand their problems better, and to kind of amplify those voices. I think a journal and other media are in a very good position to be able to do that. And so I think that certainly is something that I'd like to see more of.
Great. Thank you so much, Jamie. On the quick wins from the WR Iraq, I think the best way to ask one WR response, another WR. So, Alan, your take.
Actually, in most situations, I agree with you, but today I will disagree with you. I think if somebody from audience can also help my dear WR's question about quick win. But allow me to make 2 points. The first one about workforce for the future. Daniel, I think the reality is no. Not all the medical school and the nursing school are fully equipped to train, to provide the future generation of workforce that's ready with the right skill. But the movement is there, including in Thailand. I'm aware we are under hot discussion about how we can come out the national action plan and to do that. And this including the training capability. In terms of quick win, I think let me bring the one example from my dear colleague in Africa region. In the European region. They have done a little bit analysis from the best buy for NCD prevention to the quick buy. Quick buy means within the 5-year political cycle, we need a political commitment, right? And from evidence perspective, which one can have the, not immediately quick, but quick win. So there are set of intervention, including like raise the health tax, the smoking-free environment in the school. You can see right impact on the health.
Great. We love to see the disagreement among WRs. Hopefully you can sort out afterwards. I'm watching the Menti. It's very, very interesting. I saw equity was dominating and all of a sudden it changed. So I want the panelists to take a deep look of what we end up with on the Menti, and maybe to wrap up, just one sentence or one keyword from your side. What is the way forward? You'll say the kind of Monday morning question. Now we'll have talk about this. We'll have spent time on this topic. Then what? When you go back to your office Monday morning, then what? Just one word or one sentence to wrap the session up. We'll start from Professor from the far end and then come this way. Yeah.
So in my view, to build greater equity, I think that all countries need to have a clear plan for human resources for health, as well as all of us to contribute to a different construction of the financing architecture for health.
Well said. Thank you so much. Dashiell?
For me, it would be to continue to advocate to make health the heartbeat of development.
Thank you. Very succinct and spot on. Yeah.
So I would say partnership and co-creation.
I love that. Thank you so much, Alan.
For me, still there, I think. Prevention, and prevention. I think the most expensive health system is the one we wait until people are sick. So my wish is everyone love prevention, everyone enjoy healthy, quality life.
Great. Prevention is also right there. Okay, great. We're right on time. But before we wrap up, the secretary asked me to make a few announcements. Right after this session, we have the 5th Healthy Aging Prize for Asian Innovation happening right after. You will get the information about the venue. So just one announcement. The second one is please take a moment to share your feedback by scanning the QR on the screen. It will come up, and don't forget to really help us complete the evaluation so that in the future we can do better. And also, before leaving the room, please make sure bringing all your belongings because the room will be rearranged. Okay, so let's give a round of applause to our panelists. Thank you so much for your time, for the discussion, and for your attention. Really hope you enjoy the parallel deep dive. Thank you so much.